Hello everyone, today we will discuss about antenatal steroids. So, 10% of the birth globally account for the preterm births. Globally accounts for preterm birth. The complications of the preterm birth are the major cause of under 5 mortality. So complications of preterm birth is the major cause of under 5 mortality. So to improve the lung maturity, the antenatal steroids are being used, which leading to the decrease in the preterm neonatal death. Okay, so we'll see the benefits, mechanism of action, dose and the duration, and which week to give this antenatal steroids to the mother. Okay, first we'll see the benefits. So it leads to the reduction of neonatal death by about 32%, and there is a reduction in respiratory distress syndrome by 35%. There is reduction in intraventricular and periventricular hemorrhage by 45%. So there is a reduction in intraventricular and periventricular hemorrhage by 45%, and there is a reduction in the sepsis during the first 48 hours of the birth by about 43%, and there is also a reduction in necrotizing enterocolitis by 54%. So these are the benefits of antenatal corticosteroids. Next, we'll discuss about its mechanism of action. Mechanism of action of antenatal steroids. This accelerates the development of type 1 and the type 2 pneumocytes, which leads to structural and biochemical changes, thereby improving the lung mechanism for gas exchange. So it leads to, or it accelerates the development of type 1 and type 2 pneumocytes. So which are the essential factors for synthesis of surfactant. So that is leading to structural and chemical changes. Thereby it leads to improved lung mechanism. Okay, this is one of the mechanism of antenatal steroids. The next one is, The next one is the induction of pulmonary beta receptors. So when there is an induction of pulmonary beta receptors, which in turn leads to surfactant release. This also causes induction of fetal lung antioxidant. So there will be an induction of fetal lung antioxidant. Okay. It also causes the upregulation of the genes that are associated with the differentiation of the fetal lungs. So there will be upregulation of the genes so that are involved in the differentiation of fetal lung. So these are the mechanism of antenatal corticosteroids. Okay. Next we will see induction. What is the indication of the first course of antenatal corticosteroids? So first is the indication of the first course. So according to ACOG guidelines, according to ACOG guidelines, so women with at risk of preterm birth between the gestational week of 24 to 33 week plus 6 days are being given this antenatal corticosteroids. So these are women at risk of preterm birth between 24 week to 33 plus 6 days. 33 week plus 6 days are being advised to give the first dose of antenatal corticosteroids. They can be given this steroid irrespective of whether it is a singleton or a multiple pregnancy. Plus they should be meeting the following components. These are the preterm birth that should be imminent as evident by the onset of true labor pains, or there should be a planned premature termination within 7 days. These are preterm birth that is imminent as evident by the onset of true labor pain, or there should be a planned premature termination within 7 days. Second, there should not be any evidence of maternal infection. There should not be. There is no clinical evidence of maternal infection. Okay. As per WHO, the recommendation is of giving this antenatal corticosteroid is between 24 week to 34 week. Okay, this is the difference between ACOG guidelines and this is the difference between ACOG and WHO. This is between 24 week to 34 week, where that is between 24 week to 33 week plus 6 days. Next we will see the drugs and the dosages and duration. So we will see the drugs and duration. So here we have two drugs. First is dexamethasone, which is given at the dose of 6 mg every 12th hourly. Total of 4 doses are being given. Okay. Next is betamethasone. So which betamethasone is being used here is, it is a mixture of 1:1 which contains betamethasone acetate and betamethasone phosphate. Here Betamethasone acetate is a short acting one, while betamethasone phosphate here is a long acting. So this mixture is being suggested for the antenatal corticosteroid at the dose of 12 mg every 24 hours, total 2 doses. Okay. Why dexamethasone and betamethasone are being suggested for as a corticosteroids for this antenatal administration? Why not the other drugs? Here the reason is these steroids are less extensively metabolized by the placental enzyme. So why dexa or beta methasone is being used? This can be a viva question also. Here these steroids are less extensively metabolized by the placenta, by the placental enzyme called as 11 beta hydroxysteroid dehydrogenase type 2. It is 11 beta hydroxysteroid dehydrogenase type 2. Okay. So this is the dose and the duration of the drugs. Now what is the contraindication for giving this antenatal corticosteroids? Contraindication is only one. It is chorioamnionitis. It is the only contraindication for giving this antenatal corticosteroid. Okay. Next we will talk into the important considerations for this of antenatal corticosteroids. Important considerations. So when to administer? What is the optimal time to administer this antenatal corticosteroid? So optimal time to administer is when the preterm birth is planned or expected within next 48 hours. So optimal time to administer antenatal steroid is when preterm birth is planned or expected within next 48 hours. Okay. But even though it is optimal time within the optimal time is when the preterm birth is expected within the next 48 hours. You cannot deny a dose even when the pregnancy or when the preterm birth is just within 24 hours also. So first dose of ACS should be administered even if the delivery is imminent. Even a single dose that is given less than 24 hours prior to the delivery is associated with a reduction in neonatal mortality and morbidity. Okay. So first dose of antenatal steroid should be administered even when the delivery is imminent. It is because a single dose that is given less than 24 hours it is given less than 24 hours prior to delivery is also associated with significant reduction in morbidity and mortality. Okay, this is the first consideration. Second, multiple pregnancies should also receive the same dose. So the second consideration is multiple pregnancy. Even it's twins or triplets, everybody should also receive the same dose. Third one is, if the mother is diagnosed to have a pre-gestational or a gestational diabetes mellitus, should be administered with a complete course of antenatal corticosteroids. So mothers diagnosed with pre-gestational or gestational diabetes mellitus should be administered with complete course of antenatal corticosteroids. But what is the risk in this is, there can be a risk of hyperglycemia from 12 hours to 5 days post dose. So they should be monitored with the blood glucose level. So they can have hyperglycemia. So there is a risk of hyperglycemia from 12 hours to 5 days. This is 5 days post dose. So they should be monitored for the blood glucose level. Fourth consideration is, even when the mother is on an oral prednisolone, should also receive the same parenteral dose of dexa and betamethasone. So mothers who are already on oral prednisolone should also receive the same parenteral dose. Okay, so these are the 4 important considerations for antenatal corticosteroids. Okay. Next we will see about the repeat course. So what is the indication for repeat course? So indications for repeat course. So we should consider a single repeat course of this antenatal corticosteroids in a woman with a pregnancy of less than 34 weeks plus 6 days who is still at the risk of preterm labor within 7 days or next 7 days. Okay, this is according to ACOG. So according to ACOG guidelines, so you should consider a single repeat course for a woman who is less than 34 weeks plus 6 days at the risk of labor within next 7 days. Okay, so this is the guidelines for the repeat course according to ACOG. Okay, so when does the prior dose can be was given is when the prior dose of ACS has been completed more than 14 days previously. So prior dose or prior course. So prior dose of antenatal corticosteroids has been completed more than 14 days previously. Okay, this is also according to ACOG. The prior dose has been completed before 14 days. Okay. According to WHO, the repeat course can be given if the last dose has been completed 7 days prior. So according to WHO, you can give this repeat course can be given if the last dose is completed 7 days prior. Okay, this is according to WHO. So these are the guidelines for indications for repeat course. Next, we'll see for the other gestational weeks. What are the indications that they have been prescribed for the other gestational weeks? So according to ACOG, clinicians can consider administering antenatal corticosteroids in women between 34 to 36 weeks of gestation. This is according to ACOG and NICE guidelines. So clinicians can consider administering antenatal corticosteroids in women between 34 to 36 weeks of gestation. Okay. Next, if the woman is, or if the imminent labor is, if the woman is less than 24 weeks with imminent labor, what to do? Here, decision to administer antenatal corticosteroid should be individualized. This should be individualized according to the NICU capability and parental wishes. Okay. Next, if there is a planned cesarean section, then what to do? For women undergoing a planned C-section when she is between 37 to 38 weeks, then what to do? One second. And there is a planned C-section when the woman is between 37 to 38 weeks. So normally this planned cesarean section should not be carried out before 39 weeks. So when it is between 37 to 38 weeks plus 6 days, and what to do? You have to explain to the women or the family. An informed discussion should take place regarding the potential risks and benefits of these steroids. So an informed discussion should take place regarding the benefits and risk and benefit of giving the steroid. So what are the risks is the child can develop hypoglycemia, there can be potential harm to the fetal brain development, okay. So what is the benefit is there can be it can reduce the NICU admission for respiratory morbidity. It may reduce the NICU admission for respiratory morbidity such as RDS and TTM. Okay. So these are the risk and benefits of giving this steroids when the women is between 37 to 38 weeks plus 6 days. So this is about the antenatal corticosteroids, their mechanism of action, their benefits, their indications, their contraindications, drug dosage, and the important considerations and indication for the repeat course according to ACOG and WHO. Okay, so thank you. The PDF of this antenatal corticosteroid of this class, I will share it in the Telegram group. Kindly like, share and subscribe my YouTube channel. Thank you.